Good morning. My name is Rachel Hollberg, and today we are going to be talking about nicotine. So, what is nicotine? Nicotine is the primary psychoagent in tobacco leaves. It is naturally occurring and has the chemical formula C10H14N2. It is an addictive chemical that causes a dopamine response in the brain. It is also a stimulant that speeds up the communication between the brain and the body. A picture of the molecule is shown above. Nicotine throughout history. Tobacco is derived from the leaves of a plant from the nightshade family, which is native in North and South America. Ancient Native American shamans used tobacco for religious ceremonies. Early doctors used it for different forms of medication to help with asthma, earaches, bowel problems, fever, sore eyes, depression, insect bites, burns, and more. They also used it in pipes, cigars, and snuff. The Portuguese and Spanish sailors spread tobacco around the world during the Age of Exploration. It wasn't until 1957 that the United States Surgeon General endorsed tobacco as a direct cause of cancer. The image behind me shows a tobacco farm in South America. Important statistics. While we know today that nicotine is bad for you, here are some important statistics you need to know about. Nicotine is the cause of 85% of all cancer-related deaths in men in developed countries. 40 to 45% of all cancers and 90 to 95% of all lung cancers are from nicotine use. Nicotine can cause chronic pulmonary obstructive disease, or COPD, which is the cause of death in 75% of people between the age of 35 and 70 years. Cigarette smoking is also the #1 cause of a preventable disease worldwide. There are many different forms of nicotine exposure, some of which occur through the use of tobacco products containing natural nicotine, such as cigarettes, cigars, hookah, secondhand smoke, dipping tobacco, snuff, or chewing tobacco. Exposure by nicotine products that contain synthetic nicotine, which is made in a lab, include vaping, e-cigarettes, nicotine pouches, nicotine gum, other substitutes, and insecticides. Here are some symptoms of acute nicotine exposure according to the American Lung Association. 15 to 60 minutes after consuming or nicotine exposure, you might experience some nausea, vomiting, increased blood pressure, abnormal heart rate, dizziness, hypersalivation, confusion, or a headache. 30 minutes to 4 hours after acute nicotine exposure, you might experience diarrhea, shallow breathing, a slower heartbeat, low blood pressure, a loss of appetite, extreme fatigue, and weakness. After chronic nicotine exposure, such as years of smoking, you may experience cancer due to altered gene expression, a heart attack, a stroke, tremors, Alzheimer's disease, or osteoporosis. The image here shows a normal bone in comparison with a bone that has osteoporosis, in which the bone density is much less. This makes the bone much more brittle and susceptible to breakage. So how does nicotine travel through the body? When you're smoking a cigarette, the nicotine will be absorbed through the mucosal linings through the nose and the mouth. Then, when you inhale, nicotine passes through the lung membranes and then enters the bloodstream. After it reaches the bloodstream, it makes its way to your heart. Here, it's transferred to your arteries and then up to your brain. Nicotine reaches the brain in about 10 to 20 seconds, stimulating the release of neurotransmitters, adrenaline, and dopamine. In the liver, nicotine is extensively metabolized to a number of metabolites. Finally, nicotine will be filtered by the kidneys and then excreted in the urine, with variable reabsorption depending on the urinary pH. Nicotine effects on the mouth. Long-term nicotine usage may result in the yellowing and rotting of teeth, which causes bad breath. It also may cause gum disease, periodontitis, which is the separation of gums from the teeth. Tooth sensitivity may occur, causing painful eating and drinking. Nicotine stomatitis, or lesions on the palate, result from heat excreted by smoke and vapor products. White keratosis, which is displayed in the top left image on the screen, is the result of an increased thickness of the keratin layer of skin due to irritation. The top right image displays a tumor of mouth cancer that will likely need surgery for removal. Chemotherapy is also recommended for mouth cancer. Nicotine effects on the lungs. The image at the top of the screen displays a healthy lung on the left-hand side, the damaged lung of a cigarette smoker in the middle, and a very unhealthy, cancerous lung on the right-hand side from a chronic cigarette smoker. Long-term tobacco usage may result in emphysema, which is the breakdown of alveolar walls, causing decreased surface area in the lungs, making breathing difficult. Chronic bronchitis may occur, which is inflammation of the bronchioles. A chronic cough is common, which is the body's attempt to clear airways of debris from smoking, and increased mucus production usually causes a wet smoker's cough. Mutation of the p53 protein will occur. When p53 fails to regulate errors in mitosis, it results in uncontrollable mitosis and eventually leads to lung cancer. Nicotine effects on the brain. When nicotine reaches the brain, it allows for the activation of nicotinic acetylcholine receptors, or NACHRs, which transmit signals between nerve cells. These receptors are typically activated by acetylcholine, which functions in learning, memory, reward, and psychomotor behaviors. Nicotinic receptor signaling is important for the development of the nervous system, including synapse formation, neuronal growth, neuronal differentiation, and the regulation of the GABA neurotransmitter. Nicotine exposure alters brain development by activating NACHRs in an abnormal manner. The effects of using nicotine during pregnancy can be detrimental to an unborn fetus or a newborn baby. 15% of women use nicotine while pregnant. This can cause cancer, addiction, diabetes, and impact neural development in the offspring. It also can cause changes in the miRNA, which results in low birth weights and disrupted lung development. Prenatal impacts caused by nicotine can also last into adulthood, resulting in mental health issues, depression, addiction, and ADHD. Smoking can restrict oxygen transport to the fetus and can even cause sudden infant death syndrome in newborn babies. The top image shows a baby born without limbs due to nicotine exposure, and the bottom picture shows a baby with a cleft lip also due to nicotine exposure. A study was conducted to determine if Drosophila were appropriate model organisms in examining the impacts of nicotine on the developing human body. The study concluded that as nicotine exposure increased, survival rates decreased in Drosophila. Organisms with no nicotine exposure had the highest overall survival rates, as seen in the figure at the top of the page. Additionally, Drosophila exposed to more nicotine had lower weights than those who had not been exposed at all. That data can be observed in the bottom graph. The same results have been seen in human babies with nicotine exposure. These results supported the theory that Drosophila are sufficient model organisms to do research on the impacts of nicotine on developing humans. Nicotine exposure from electric smoke. E-cigarettes have been on the market in the United States since 2007. Not much is currently known about the effects of nicotine salts on the body. Inhaling aerosols from nicotine salt-based e-liquids allows the vapor to use a higher concentration of nicotine, up to 60 milligrams per milliliter in the United States. A study on nicotine smoke and vapor. The smoking is deadly message has been presented to us to lead us to believe that chemicals added to cigarettes cause the most health issues. A study by Clement Mercier et al. Determined that there are over 250 chemicals in e-cigarette aerosols. An in vitro evaluation of the aerosols using a fourth-generation Juul revealed that nicotine salts cause high levels of oxidative stress and that flavored e-liquids are cytotoxic, causing irritation and damage to the respiratory tract. This image displays the mechanism used to extract aerosols from the Juul device and then measure its contents. If we know nicotine is bad for us, why do we still use it? It has gained recreational attraction as a mild stimulant that is associated with an improved mood and feelings of pleasure. Pros to using nicotine are focusing effects, improving productivity, combating anxiety, and promoting mental focus. Some may use it for cultural and religious traditions. Others may be due to peer pressure or outside influence. For instance, advertising companies spent $7.4 billion in 2020 promoting cigarette use in the United States alone. If we know the consequences associated with nicotine use, why is it still legal? In 2020, revenue from smokeless tobacco sales alone was $4.82 billion. The tobacco industry provides thousands of jobs. It is a major source of income for marketing industries, media, and the government, which contributes to its widespread use in the United States today.